in the intense world of medical emergencies.
I'm worried that you punctured your right lung.
There's nothing more extreme than a code red.
He's been hit by that JCB vehicle there.
It means there's an immediate threat to life.
Any pulse? Can you just check?
No, I can't feel anything.
In the West Midlands, highly specialist teams are ready to react to these major traumas.
Patient's fallen from top flight of the stairs.
By road.
Our ETA is about 2 minutes.
And air.
Patient has a large wound. Yeah, affirmative, all received.
These emergency doctors and specialist paramedics
I'm going to get you out, all right?
use cutting-edge trauma techniques in surgery, normally only seen in operating theatres,
John, there's some more very strong painkiller going in now.
to save people from almost certain death.
Celox, please, at major hemorrhage.
OK, stand clear. Shocking.
From car crashes
Rob, I'm just going to lift your feet and we're going to look at getting you out, OK?
to stabbings.
Gentleman has turned on Sean with a meat cleaver.
Filmed alongside the critical care teams,
If we'd have left it, your heart wouldn't have restarted.
we captured every vital second as these specialist crews work to save lives.
Let's get him on the ambulance.
Lift. Okay, nice and high.
Honestly, trust us.
Tonight,
Okay, so we are on our way to Wales.
a critically injured man undergoes roadside surgery after being crushed under a hay bale.
We're going to do the anaesthetic now, and you're waking up in the hospital, OK?
She's down the bottom of the stairs.
The critical care team are dispatched to a woman who has collapsed at home.
I feel awful.
Do you feel as if you're going to faint? Do you?
Yeah, I feel awful.
Okay, guys, just come out of the way for us a little bit, please.
A man is found in cardiac arrest at work.
Bit hard on the chest for me, mate.
So it's clipped the bike and you've gone down. Yeah, but you're wearing a helmet.
And a motorcyclist needs medical attention after colliding with a car.
Do you think you were knocked unconscious at all?
No, but at one point I was feeling a bit dizzy.
Ambulance, full of justice.
Hiya. Just had a fella's just had a bale of straw drop on his head. This big bale of straw just landed on his head. Got a blood coming out of his mouth and his nose.
Right, okay.
He's got pushed between the bale and a trailer. He's saying he can't breathe very well.
Okay, I know you've mentioned the head. Has he injured anywhere else at all?
His shoulder, his back, and I've just rubbed his arm slightly and it's hurting.
A man is struggling to breathe after an accident on a farm. With potentially life-threatening injuries, Helimed 03 is immediately scrambled. Critical care paramedic Will Meadows and Dr. Steve Dauncey are on board.
Okay, so we are on our way to Wales to support the Welsh ambulance with a male who's been crushed by a hay bale with head and chest injuries. We need hay bales to weigh in excess of half a tonne.
On the ground, a team of critical care paramedics are already at the scene, but they are concerned the patient is very badly injured. They've requested a doctor because the patient may need surgical intervention before being transferred to hospital.
We're overhead scene looking to land. Looking to land.
After a 23-minute flight, Will and Dr. Steve arrive at the remote location. Wales Air Ambulance Service, who have been treating the patient, brief them on their assessment so far.
This is John. One of the big square bales, looks like it's about a tonne, probably more, has come off the front of the low loader and pinned him to the trailer. Now he was trapped for probably 6 or so minutes.
Crushed under a bale weighing around a tonne, the weight of a small car, John has suffered serious injuries.
He has got left anterior chest, probable dislocation with his sternum here, probably 5 to 6 ribs, and massive hyperinflation. He's got hyperinflated with no chest movement on the left side. He's developed quite a lot of surgical emphysema on the left upper chest. I've done an ultrasound and he's got a definite pneumothorax on the left-hand side of his chest.
As well as broken bones, John also has a potentially life-threatening pneumothorax, a collapsed lung. Air is leaking into John's chest cavity. This air is pushing onto the outside of his left lung and causing it to collapse. He's at high risk of cardiac arrest.
He's had in total 30 of ketamine, he's had 10 of morphine, he's had 4 of ondansetron, 1 of TXA and 1 of paracetamol.
The team have given John powerful pain medication together with a sedative. As he has been through a major trauma and likely to have internal bleeding, tranexamic acid has also been administered to help the blood clot.
He still looks a wee bit kind of hyperexpanded on that side, doesn't he?
Yeah.
Hello, John. Good to meet you. My name's Steve. I'm one of the air ambulance doctors. We're going to get you off to the hospital in Stoke shortly. We're just deciding what we need to do for you before we travel to make sure you're safe during the journey, John. You saw on this side of your chest, on the right side, John. So a fair bit of surgical emphysema on the right side.
Oh, right now, there wasn't
and
about
across the
10 minutes
midline.
ago.
So I guess the concern is that's kind of a picture that's evolving a little
Definitely.
bit. Yeah.
With air now seeping into the right side of his chest cavity as well as his left, John's condition is becoming critical.
I'm a bit concerned by the fact that surgical emphysema is evolving quite quickly. It's now crossed the midline. It's got right-sided surgical emphysema now. Those things, to me, point towards the safer bet with a 15-minute flight, 15 minutes FAF, half an hour journey being pre-hospital OSI, formal decompression of the left side of his chest.
Dr. Steve has assessed John is too unstable to fly to hospital. He's now struggling to breathe and needs immediate surgical intervention.
Yeah, I think outside the truck for that 10-minute period of RSI would be the best thing, then we can get into thoracostomy. What we're going to do, we're going to pop you off to sleep, John, for an anaesthetic, and take you to hospital so you'll be comfortable, and we can sort out your chest, which I think is causing you bother. I think you've got some broken ribs on that side. I think you've got some air that's leaked out from the lung, and it's outside of the lung, and it's also underneath the skin there. And that's a problem that could get worse on the way to hospital.
John will be anaesthetised at the roadside, so Dr. Steve and the team can then cut into his chest to perform a thoracostomy. A surgical procedure to try and release the trapped air and reinflate his collapsed lung.
Rock uranium 0424.
Quick intervention is needed to prevent cardiac arrest and save John's life.
Morning, this is Steve Mitchell on duty.
At base, Midlands Air Ambulance critical care paramedic Mitch is preparing for his shift.
That's the critical care drugs pouch. The set of medications that are a little bit out of the normal remit for a normal ambulance, and that's why we as a team carry them.
The drugs Mitch can carry include sedatives like ketamine and rocuronium, which can be used to completely paralyse patients if needed. Today he's responding by road to life-threatening emergencies across the Midlands.
Ambulance services, patient breathing. He is breathing, yes. The employee's just collapsed on the floor at work. Is he conscious now? He's unconscious, he's breathing, but he's turning blue. Right, okay, if he's turning blue, can somebody get a phone by this patient? Because obviously if he's turning blue, he's not breathing properly, so we need to start some CPR We've got a instructions. first aider on the way to him. Right. Are you going with the defib? Yeah, the first aider's going with the defib. There'll be somebody there with the defib.
All received, mobile.
999 mode activated.
A man unconscious and struggling to breathe is a Category 1 emergency. As well as 2 ambulance crews, Mitch's enhanced drugs and life-saving skills are urgently needed.
Yeah, we've been tasked to a gentleman that has suffered a cardiac arrest. So every second counts. For every minute that somebody, if they need defibrillation, doesn't receive it, their mortality increases by 10%. So 10 minutes, that patient is likely to not survive.
The patient was found unresponsive by workmates. It's unknown how long ago he collapsed. As Mitch arrives, the ambulance crew are already on scene.
Where are we going? Straight through this. Where? In here. Okay, guys, just come out of the way for us a little bit, please. Okay.
55-year-old Arto is unconscious and not breathing. His colleagues started CPR until the ambulance crews arrived and took over.
So collapsed behind the toilet. They've been doing CPR on him for some time before our arrival. Our initial assessment is PEA.
Yeah.
We just set the airway.
Yeah. 5 minutes. Non-shock.
Non-shock. No
Okay.
shock whatsoever.
Bit hard on the chest for him, mate.
The crew confirm Arto's heart is not beating. He is in cardiac arrest. Mitch and the team need to act fast.
Yes, and just roll him over.
Yeah, go on.
Okay. I'm back. Okay, back on the bag. Sorry, mate.
Arto's heart is in a rhythm that cannot be shocked with a defibrillator. With time ticking, the team need to rely on other ways of resuscitation.
Okay, I'll set it to 32 to start off with, and then just grab an adrenaline inhales once you've done that.
One of the specialist pieces of equipment carried by the critical care team is the Lucas, an automated chest compression machine. It ensures blood is pumped around the body to prevent organs being starved of oxygen.
Just keep going, and then it'll do, and then just basically. So, and have you got a bag of fluid in there at all?
We will have bag of fluid.
Yeah.
They manually ventilate and administer fluids and adrenaline, which increases blood flow and can help in restarting the heart.
Just keep ventilating, that's it.
So, we've got adrenaline, fluids.
The team are doing all they can, but they need to get a pulse quickly. Every minute they don't, Arto's chances of survival get slimmer.
Ideally, if you can bring the truck even a wee bit oblique like that, then we'll be in the shade of it.
In Wrexham, Dr. Steve Dauncey and Will Meadows are treating 53-year-old farm worker John, who was crushed in the chest by a hay bale. Having assessed the patient, Dr. Steve believes John's best chance is to undergo emergency intervention on scene.
We're going to get that sorted out for you in just a moment there, John. The other thing we need to get out ready to go is the thoracostomy kit, so we can just pop that straight in.
The critical care team need to perform a thoracostomy, a surgical procedure which involves an incision between the ribs into the chest and lung area to release the trapped air, endangering John's life.
John, there's some more very strong painkiller going in now to get things more comfortable for you. That's 50 mites of fence. You've had some more very strong painkiller, John. We're going to do the anaesthetic now, and you're waking up in the hospital, okay?
Although they're in the middle of a country road, the procedure is carried out exactly as it would be in hospital.
I'll just have a little bit of metronome to hand. Right, guys, are we ready and happy for checklist now? End tidal connected. We're just going to take either side of your ears there, John. I'm just going to pop a wee soft thing underneath the back of your head. I can do that, guys. Will's going to be first intubator, and I'll be second.
First, John needs to be anaesthetised.
Rocuronium's in.
After sedation, Dr. Steve administers rocuronium, a drug that completely paralyses the patient.
So that's 100%, guys. 40 seconds. We're starting to look now, chap.
That's it, John. Well done.
Give me a shout when you're ready to go, Will.
We're pretty much good to go.
Once it's taken effect, the team need to quickly intubate John by placing a tube down into his windpipe so they can take over his breathing.
So I can see the space. Okay, and I've got the cords.
Will gets John's vocal cords in vision so he can pass the tube into the windpipe.
Okay, bougie please. Okay, and tube.
I had the bougie.
I've got the tube. Okay, and that's through vocal cords.
Push out.
Please, don't get the tube.
Push out. Cuff up.
Yes, please.
Feels good?
Feels good on the right side of his chest, definitely feel it inflated.
Got CO2. Pipe it off, please.
And we've got misting of the tube.
Well done. Well, fantastic.
Now successfully in control of John's airway, the team can begin the thoracostomy, which involves cutting a hole into his chest in order to release pressure caused by the air leaking from his lungs.
BP still good, SAT's still good, guys. You've got loads of time for the thoracostomy, don't need to rush, okay?
Quite a lot of blood coming out. Big bubble.
If you feel it's ongoing bleeding, then we might need to put in a chest drain, but if it's just a flush, then that's fine.
The trapped air is now released from John's chest.
Celox, please, out major hemorrhage.
Red bag, there's a hemorrhage.
Oh, there you go, sorry.
You might just hit one of those.
Quite a lot of blood coming out.
John is bleeding from the thoracostomy site. Severe blood loss can lead the patient going into fatal shock.
Give it a good old, nice, firm, direct pressure.
It's just really hard to see where it's actually coming from. I've just mopped up quite a bit there.
Okay.
I think it's definitely a tissue. I thought it was arterial, but it's not.
Okay, so let's make a final call on this chest then.
Do you want to have a quick look? Do you want to feel? It's definitely stopped.
Okay, if we leave it open like that for now, and we're quite happy with that.
Fortunately, John's bleeding is not as serious as initially suspected.
It seems to have stopped. So.
There is air entry there, so.
The procedure is complete, and John can now be put on a mechanical ventilator.
Grand, okay. Good, I'm going to pass a pre-alert now then, guys. Are you happy to coordinate the move?
He's in a critical condition, but now stable enough to be flown to hospital.
Ready, steady, lift. We're going to go.
So we are bringing in a 53-year-old male, time of injury 100 hours.
Dr. Steve calls in a pre-alert, so the hospital has a team in place to treat John as soon as he arrives.
Mechanism was crushed by a approximately 700-800 kilogram hay bale. Injuries are to the left side of the chest and left anterior chest. Suspected multiple rib fractures, pneumohemothorax, and possibly a flail segment on the left-hand side so far. We are conveying by air to Stoke with an ETA of approximately 20 minutes.
There we go. That's it, that's it. Okay, I'll put it.
Dr. Steve and Will have decided John needs to be taken to Royal Stoke University Hospital. It's a major trauma centre with all the medical expertise and facilities available to treat his injuries.
Okay, 101, no water cautions, just in the bottom of the takeoff band, tail is clear right.
And after an 18-minute journey,
03, second on ground, Stoke.
John's handed into the care of the emergency doctors.
Got end-tidal CO2, got supply pressure.
With such traumatic internal injuries, only time will tell how well he recovers.
Is the patient breathing?
It's my 76-year-old auntie. She's fallen down the stairs. I'm worried that she might have had a stroke. She can't move her arm. She can't really talk to me very clearly. She can't move, basically.
Okay.
And she's sort of dribbling a little bit out of the left side of her face.
Where is she complaining of pain?
Her side and her back and the back of her head. Oh, hang on, the back of her head's bleeding.
With the possibility it's a time-critical emergency, an ambulance is immediately dispatched, and so too is critical care paramedic Faye Pollock.
I am going to a 76-year-old lady who is poorly. We're not entirely sure why, but we think that she may have suffered a stroke.
Every 5 minutes, someone in the UK has a stroke. Blood supply to the brain is cut off, and brain cells begin to die within minutes.
Time is of the essence with her. Time is ticking with any person who suffers a stroke.
The patient was found at the foot of her stairs at the home she shares with her son.
Hiya. Okay.
Is it down the bottom of the stairs?
Right. Hello. What's your name?
Doreen.
Doreen. What's happened?
Well, I had a allergic reaction to antibiotics I took at dinner time.
Ah, okay. Doreen, I can see that you're nice and conscious. You're breathing.
Faye establishes she may be dealing with something other than a stroke.
Okay. Let's get you in a more comfortable position.
Doreen believes she's had an allergic reaction, but the fact that she is lying awkwardly at the foot of the stairs is Faye's main concern.
When you say allergic reaction, what do you think happened?
All my lips were all tingling and I was itching and scratching.
Okay.
So I went upstairs and took an antihistamine.
How have you ended up here? Have you fallen?
Yes.
You've fallen from where?
The top.
You think you've fallen from the top?
Rolled down. And there was a big jar there.
So you cracked, the jar's cracked?
And I cracked
on the
my
back
head.
of your head, right, okay.
Yeah.
Is that where you've got some pain? Have you just got pain in your head?
No, it's all down. Oh, it's down
Right,
here, I can't
okay.
move.
Let's forget the allergic reaction for the moment. Let's have a look at your injuries and then we'll go from there.
Whatever the cause, Doreen has had a bad fall down the stairs, and Faye's priority now is to assess her injuries.
Where's your nephew? Where's
my son's in there.
Your son? Can he come on the other side, open the door and help prop his mum up, please? Philip, hello.
Hello.
Hello, how you doing? Can I trouble you to just come and just prop your mum up this side? Because I think she's putting all the weight on it. That's it. Just for a few minutes, just whilst I have a little look to see if I can find any injuries. Yeah. Any pain as I'm feeling in your neck? No. Any pain as I'm feeling in your head?
Just a little bit.
Faye examines Doreen, including her head injury, which could explain her confusion.
I can see that you've got a nice bloody towel just there. I'm just going to have a little feel around the rest of you. No pain as you're talking. Any pain in your chest?
She has an open wound in the back of her head, and the pain Doreen is experiencing in her torso could mean she also has a chest injury.
Take a nice deep breath in for me. Oh, is that where? This side? Yeah. All at the back? Okay. I'm going to have a little feel round the back.
Faye needs to assess Doreen for broken ribs and any damage to her spine.
Is it here where you're touching the wall?
Yeah. It's all down. It's when I go to move.
Okay.
Confident that it's safe to do so, Faye gently lifts Doreen into a chair to give her more support.
I think you're going to have to go up to hospital, Doreen. I think you're probably going to need an X-ray.
To check whether a major heart event has caused Doreen to collapse and fall, Faye tests Doreen's heart rate using an ECG or electrocardiogram.
On a scale of 1 to 10, 10 being in the worst pain that you've ever been in, ever, how much pain are you in?
About 7 to 8.
About a 7 to 8, okay. That's all right, that's all good, Doreen. What we'll do is I'll pop a little needle in the back of your hand and then we'll give you some paracetamol, but it's directly into your blood, so it goes quicker.
With her heart readings normal, Faye's now keen to alleviate Doreen's pain.
Why do you feel as if you need to lie down?
I feel awful.
Do you feel as if you're going to faint? Do you?
Yeah, I feel awful.
As Faye is preparing to give her intravenous pain relief, Doreen suddenly takes a turn for the worse.
We're going to move you now, Doreen.
I feel really funny.
Do you feel as if you're going to be sick?
Yeah.
In Redditch, critical care paramedic Steve Mitchell is working with an ambulance team to resuscitate Arto.
Keep ventilating.
Just keep going.
Yeah, just keep going.
A 55-year-old man who collapsed at work and is in cardiac arrest, which means his heart has stopped beating.
What we'll do is we will do a rhythm check now. He's likely got a pulse underlying, okay. I've got a pulse. Okay, so.
The team has managed to restart Arto's heart, but he's at high risk of re-arresting at any moment.
We need to get a tube in him. Hayley, you come up the top here and then keep ventilating him. So I need you to go sort of fairly fast, so around the 20 rate, but nice big ventilations.
With his heart beating, the team now need to maximise the amount of air getting to his lungs. So Mitch prepares to intubate, which involves putting a breathing tube down the windpipe.
Okay, keep going ventilation there. Okay, that's it. So 95 sats. If those sats drop down below 90, just give me a shout, okay? I'll tell you what, suction first as well. So...
We've not got a pulse.
Suddenly, Arto's heart stops beating.
And adrenaline.
He's back in cardiac arrest. Automated CPR is restarted.
So that's Lucas providing a bit of so I think we've got a ROSC in the background there.
Yeah. A ROSC, or return of spontaneous circulation, means the heart is now pumping again.
Okay, his colour's come back to him a little bit there, hasn't it?
Mitch can now start the intubation.
Okay, and then just give us that pressure on his neck for us. That's in, okay. Tube over, keep, that's it. Okay, that's in. Okay.
Happy for the bougie to come out?
Yeah, come out. Lovely. Okay, perfect. Okay, and what we're going to do is going to do a rhythm check now at 19 minutes. Okay. Pulse there. Keep ventilating for me now, so that's it. Is end tidal? Yeah, I've got a pulse there. Okay, super.
The team have successfully resuscitated Arto and are now in control of his breathing.
If we can start getting the carry sheets ready, just put his feet in.
Just sliding for me.
Okay, ready, steady, roll. Perfect, well done guys.
Okay,
happy?
We're dragging, ready, steady.
Arto is still in a life-threatening condition and needs urgent hospital care. For the journey, the Lucas machine remains in place because there is a chance he will go back into cardiac arrest.
Ready, steady, lift. Okay. So the wife's here, is she?
Yes,
okay.
Arto's wife, Natalia, has just arrived to be by her husband's side.
Natalia, his heart is beating, he's not breathing for himself yet. His heart had stopped and we've had to revive him, okay.
As Mitch prepares to pre-alert the hospital...
So he's done a BM. Oh, so he's gone into VF, mate, so charge. Okay, stand clear. Sorry.
All right, Natalia, well done.
Okay.
Yeah.
Okay, he's going to do that again, sorry.
All right.
Arto goes back into cardiac arrest. 2 shocks with a defibrillator successfully brings his heart back into action, but the chances of his survival lessen every time he arrests.
Arto, Natalia's here, okay.
What does he suffer with? What's his past medical history?
Yesterday he told me, so I feel not good. I am asking, what pain for you? Yeah. He said the back.
So he had pain in his back yesterday?
Yes, yesterday.
Okay, yeah, just that's fine. Sorry.
As they arrive at the Alexandra Hospital,
That's it.
Arto's heart stops yet again.
Rhythm check. So, potentially got a ROSC with that, or bradycardia.
I think is there something under there?
Having shocked the heart into life for a 5th time.
So there is a pulse, yeah, I've got a pulse, and he's breathing for himself there.
Mitch and the ambulance crew have done all they can to give Arto the best opportunity of pulling through. They now hand his care over to the emergency hospital team.
That is still the same.
S3E3 lifted with an ETA of 4 minutes.
Midlands Air Ambulance Charity operates and funds 3 air ambulances covering 6 Midlands counties. It's one of the busiest air ambulance services in the UK. Since it began in 1991, the charity has responded to over 70,000 incidents.
1, 2, 3.
She's been thrown from the horse and impacted into a concrete step.
Where's all the pain? Oh, it's okay.
As well as aircraft, the charity has 3 rapid response vehicles. Checking the onboard medical kit at Cosford Base are critical care paramedics Rob Davis and Liam Webb.
Scalpel 22. Should be 2 of those. 2, yeah. Spencer Wells forceps, 2 of those. 2, yeah. Russell chest seals, 2, yeah. And a pneumafix with blades, so that normally just taped to it. Yeah. Tape. Spot on. All happy. Good. That's good, mate. Yeah, sound.
They're all set to respond by road to emergencies across the Midlands.
Ambulance services, the patient breathing.
I can't really see from here. I live in the high-rise platform and I've just witnessed someone get hit off a motorbike. Gone into the side of a car he had, a motorbike. I just looked out the window and I'm seeing him drive down the road and fall into the side of the car.
We're going to him as fast as we can, sir.
999 mode activated.
A motorcyclist who's collided with a car could have serious injuries. As well as an ambulance, the Midlands Air Ambulance team are immediately dispatched.
There's reports of a motorcyclist possibly ridden into the side of a vehicle.
Over 300 people a year die as a result of motorcycle accidents. And 1 in 3 accidents leave riders with severe injuries. Liam and Rob arrive at the scene within 5 minutes. The patient is 24-year-old biker Brandon.
Hi mate, you all right?
Hiya, what's happened is basically he's come down here. The lady was coming across, the other lady...
Which way were you coming, mate? Sorry, coming straight up the road?
No, she's gone across, he's gone down, and because the sun being so, they've clipped. Does that make sense?
Brandon's mother, who lives nearby, has been able to help her son in the minutes following the incident.
So it's clipped the bike and you've gone down? Yeah, but you're wearing a helmet?
Yeah, his helmet's over the other side of the road.
Was the helmet clipped up?
Yeah.
Properly clipped up and everything like that?
Rob needs to assess Brandon to see whether he's been injured.
Do you think you were knocked unconscious at all?
No, but at one point I was feeling a bit dizzy. And
Felt a bit dizzy?
Yeah.
Have you got any injuries that you can feel at the moment?
I don't know, I think I've done something to his hand, hurts a bit, but probably minor injury.
Okay, well, I'm just going to have a quick look around you and just make sure there's nothing major going on at the moment. We'll try and keep you warm and we'll go from there.
Dizziness can be a sign of traumatic brain or spinal injury. As Brandon may have suffered a blow to the head in the crash, Rob can't rule anything out until he's done a thorough assessment.
So from your head, Brandon, you've got no pain in your head or anything like that. I'm just having a quick feel around back of your head. Anything on the back of your neck?
No.
Press in there. That feels fine. Look up for me, mate. Nice and straight. Okay, in your shoulders. How does it feel on there, on your collarbones? Okay, feels all right. I'm not going to undress you out in the road. Give us a nice big deep breath in with your chest. And out again. Okay, in and out. No, don't worry about that. Go on, in and out. Beautiful. Good. How does that feel? Yeah, good. And in your arms, both sides, you can move your arms all right?
Rob's initial assessment of Brandon reveals no signs of serious injury. He may have been extremely lucky, but without further monitoring and checks into his dizziness, nothing can be ruled out.
Do you feel as if you're going to be sick?
Yeah.
In Burton-upon-Trent, critical care paramedic Faye Pollock is treating 78-year-old Doreen, who's taken a bad fall down the stairs.
Let's move you.
She's hit her head and may have internal injuries. But now Doreen is feeling nauseous.
Sick. You're going to be sick? Yes, please. Hang on. Oh, bless you. Thank you, thank you. Here you are if you're going to be sick.
Faintness, nausea and sickness could be signs of traumatic brain injury from the fall.
If you can come up onto your feet like you did last time.
Faye wants to get Doreen into a more comfortable space where she can lie down and be monitored more easily.
Phil's got one side of you, I've got the other. And then very slowly, just reverse. Phil and I have got you. We've just got to get you to the sofa. I know. That's it.
I don't know what to say.
That's fine, it doesn't matter. We're just going to get you straight onto that sofa. Lie down flat there, on your back. Sorry.
Faye tries to alleviate the faintness by lying Doreen down flat on her back.
I'm sweating.
I know, we need you to put your feet up and we're going to raise your legs into the air. That's it, Doreen. Right, lift, Doreen. I'm going to lift your legs up. Let's get you...
Lifting the legs above the heart will bring more blood flow to her head so she doesn't lose consciousness.
Right. Is that better?
An ambulance is en route to take Doreen to hospital. But with the risk of brain or internal injuries, Faye continues monitoring her heart rate and blood pressure for any changes that could indicate something serious.
That's going to go a bit tight. You have fallen top to bottom of the stairs, and if you've just caught one of those steps, right in your back, you must have been winded and totally your breath taken away from you. So that's why I think we need to go and get it x-rayed. Right, we'll take a little drop of blood. This is just to make sure that your blood sugar is okay, and then we'll give you that pain relief.
After trauma, blood sugar levels can rise. This can cause more complications with recovery, especially if there has been an injury to the brain.
Just a sharp scratch on the end of your finger, Doreen. Coming up now. Well done.
Doreen's blood pressure, heart rate and blood sugars are all showing as healthy.
No. Oh, it hurts your back to cough. You are good.
Faye's concern now is possible fractures and the laceration to the back of her head, which she needs to assess.
I've gone down with a good crack. You're going to need that gluing. Something, we're just feeling her. Have you just pop that blanket over her shoulders, do you mind? Because she's super cold. Oh, I know.
Doreen is clearly in pain, and Faye needs to get a cannula into her arm to administer paracetamol intravenously.
You haven't got the best veins, have you, Doreen?
They're normally good.
Not tonight.
Try this one.
Let's have a little look at this one, and then we'll come back to that one if this other one's not terribly good. A bit more with it. Doreen, just a sharp scratch in the back of your hand. Relax. Well done. I know that's a bit sore, and I do apologise. It's just for a second. Hello, how you doing?
With Doreen stable, Faye is happy to hand her to the ambulance team who've just arrived. They'll take her to hospital for further assessment. Faye updates them on her findings.
She's taken a tumble. I think she's done a gamble. She has got a laceration to the parietal head, probably about 1 centimetre. Certainly not knocked out. GCS of 15 throughout. Doreen's also got pain, left-sided lumbar area of her back.
Right.
How are you feeling now? Doreen, is it?
A bit better than what I did.
You've got your chariot, look at that for service, your chariot awaits. Let's get you into the ambulance. So we're going to stand you up on your feet, nice little spin round. That's it, all you need to do is just do a left-hand turn. Trust us that the seat is behind you.
Doreen is taken into the care of the ambulance crew for the journey to hospital.
She has gone with the ambulance crew to Derby Royal Infirmary, and they will be an absolutely ideal hospital to treat Doreen for her injuries, and hopefully in a couple of hours, let's hope she hasn't done anything too catastrophic to her chest, maybe just swollen tissue, and she'll be coming home.
In Stafford.
What about in your hips? Your hips feel okay?
Critical care paramedics Rob and Liam are assessing 24-year-old Brandon after he was involved in a collision with a car.
Did you get up and walk to the side of the road and sat down?
Yeah, I did, yeah.
Fine, okay. Just going to take your pulse then and see how your pulse is doing, mate. All right. And you say the main thing you've got is you've got a bit of pain in your both hands. Did you have gloves on when you were riding?
Yes.
Good lad. Sounds like you got away with it, mate.
Rob is manually checking Brandon's pulse, which is normal. There are no signs of any serious injury.
What have you got? Bit of pain in your hand? Just on your knuckles? On the back there, or?
I don't want to go like this. It was a bit tense, like here.
Okay.
So here and a bit here.
Okay. Anywhere, anything else in your legs? Nothing like that? You're not scraped your trousers?
No, look, I've got a couple pair of trousers.
Got a bit of scrape on there. Can I just have a look and just see if there's anything on your knees or anything, mate? Bit of a scrape there.
Although he's not wearing full protective gear, the fact that Brandon was wearing gloves and a helmet has saved him from serious harm.
I live at other side of town, but I've just got my mum's.
You're at your mum's? And where is your mum's? How far?
Just up there, just like in the middle of these.
Should we try and walk?
Getting cold. Should we go to your mum's front room and chat?
And then we can wander up the road and we can do blood pressure and stuff properly. We'll give you a hand to stand up and then we'll just walk you up the road quietly, all right?
All right, mate. You ready?
Ready, step.
Ah, perfect. Well, you're tall, aren't you?
Ready, step.
Shock can make the body less able to regulate its temperature and heightens the risk of hypothermia. With Brandon's mother's house so close by, Rob and Liam are keen to get him into the warm.
Go and have a seat, pal, while we nip in your house and take over. If you take your jacket off and your top, just so we can get one arm out so I can do your blood pressure. Have a seat, Bran. And I don't think you need an ambulance to go up to the hospital right now, and I think you'll be all right. I think normal thing, bit of paracetamol for aches and pains. If you find your hand is still really painful, then you can go up and attend the hospital. Yeah.
All Brandon's vital signs are normal and stable.
Painful in your hand, yeah?
Yeah.
Okay.
I can still clench it, so I can't be broken off them.
Yeah.
Could be just badly bruised.
Yeah, you could well have bruised it. So, and did you go down that side onto it, do you think?
Could have been.
Yeah, so maybe where you've held onto the handlebars. Yeah.
He seems to have escaped the crash with only minor injuries. So Rob and Liam are happy to release him from their care.
Bit of a shock, so I think you've got details of the other lady and stuff. No, that's right, mate, that's what happens. You call, we turn up. All right.
Unlike some other calls on their shift, for the critical care team, it's been a good outcome.